Welcome back to Medical English Buddy. I'm your host, Eric.
And I'm Professor Buddy. It is a pleasure to be here to discuss another life-saving topic.
Today, we are discussing a frightening and fast-moving situation, severe allergic reactions. Have you ever eaten something and suddenly felt your skin crawling? One time, I ate a piece of shellfish and my lips swelled up instantly. I looked like a cartoon character. I was panicking, thinking, is this it? Should I call everyone I know?
It is understandable to be concerned, Eric. While some reactions are mild, if your throat starts to feel tight, it is a medical emergency called anaphylaxis.
Anaphylaxis? That is a serious-sounding word. Before we dive into the scenes, let's head to a restaurant where a casual lunch turns into a crisis. Pay attention to how the patient describes their initial symptoms.
Something is wrong. My throat is suddenly very itchy and tight.
Oh no! Did you have the pasta? It contains a walnut-based sauce.
Walnuts? I was unaware. I believe I am breaking out in red bumps everywhere.
You look very pale. I am going to call an emergency ambulance right now.
Yes, please. I can feel my heart racing and it is becoming difficult to swallow.
Please stay calm and try to breathe slowly. Help is on the way.
Wow, that escalated quickly. My throat feels tight. That is a major warning sign, right?
Precisely. In the clinical world, that tightness indicates the airway may be swelling. The patient also said they are breaking out, which is a common phrasal verb meaning a sudden appearance of skin rashes.
Right, those red bumps are hives.
Correct. In medical terms, we call them urticaria. It is a primary sign of a systemic allergic reaction. If you see hives spreading rapidly, it's a signal that the body is in overdrive.
The server noticed the patient looked pale, and the patient felt their heart racing. The situation is getting worse. Let's follow them to the ER.
Please sit here. I can see the swelling in your face. Can you speak clearly for me?
It is difficult. My chest feels very heavy, as if someone is sitting on it.
I am checking your oxygen levels. Your saturation is slightly low. Are you feeling dizzy?
A little. My head is spinning and I feel like I might lose consciousness.
You are experiencing a severe reaction. I will start an IV and get the medication immediately.
Please hurry. It feels like I am breathing through a very thin straw.
My head is spinning. Is that because of low blood pressure?
Exactly, Eric. We call this hypotension. During anaphylaxis, blood vessels dilate, causing blood pressure to drop, which leads to dizziness or lightheadedness.
And the patient said, I feel like I am breathing through a very thin straw. That is a terrifying image.
It is a very vivid and accurate way to describe a narrowed airway. As a nurse or doctor, hearing that phrase immediately moves the patient to the top of the priority list.
Now the doctor has arrived to confirm the diagnosis. Let's listen to the clinical side of things.
Hello, I am the attending physician. I am going to listen to your lungs. I hear some wheezing.
Is it serious? My voice sounds very raspy now.
Your airway is narrowing due to the allergy. Do you have any history of asthma?
No, this is my first time. I consumed walnuts by mistake at dinner.
This is a clear case of anaphylaxis. We must act quickly before your airway closes.
I am very frightened. Please do whatever is necessary to help me.
The doctor mentioned wheezing. That is that whistling sound when someone breathes, right?
Yes, it means air is struggling to pass through the constricted bronchial tubes. It is a critical red flag. Also, notice the patient's raspy voice.
Like they have a sore throat?
More than that, a raspy or hoarse voice indicates swelling in the vocal cords, which is a sign of impending airway obstruction.
This is a true emergency. It's time for the lifesaver, epinephrine.
I have the epinephrine ready. I need to give you this injection in your thigh immediately.
A shot in my leg? Is it really necessary to do it right now?
Yes, your airway is narrowing, and this is the fastest way to stop the reaction.
Will it be very painful? I'm already feeling quite overwhelmed.
It is a quick poke, but it is a lifesaver. You will feel your heart race, but you will breathe much better.
Okay, if it helps me breathe, please go ahead. I trust you.
Epinephrine. That is the main medicine used in those auto-injectors, isn't it?
It is the primary treatment. It works rapidly to constrict blood vessels to raise blood pressure and relax the muscles in the lungs to open the airway.
The medical staff mentioned the heart might race. That sounds intense.
It is a common side effect because it's essentially a shot of adrenaline. But compared to not being able to breathe, it's a very small price to pay.
The treatment was successful, but the patient isn't going home just yet. Why?
How are you feeling now? The redness on your arms is beginning to fade.
Much better. The tightness in my chest has subsided and I can breathe normally.
That is excellent. Your blood pressure has stabilized as well. We will monitor you for a few hours.
Why is it necessary to stay if I feel better now?
Occasionally, symptoms can return in a second wave. We need to ensure your safety.
I understand. It is better to be safe. Thank you for your help.
A second wave? You mean the allergy can come back even without eating more walnuts?
Yes, we call that a biphasic reaction. It can occur 1 to 72 hours after the initial symptoms have cleared. This is why we never just send an anaphylaxis patient home immediately.
That is a vital piece of information. Better safe than sorry definitely applies here.
Exactly. Now that the patient is stable, the doctor is giving instructions for the future.
You are cleared to go home. However, you must carry an epinephrine auto-injector at all times.
How do I use it if this happens again? Do I use it through my clothing?
Yes. Remember, blue to the sky, orange to the thigh. Push firmly for 3 seconds.
I understand. Should I also see a specialist for more tests?
Yes, follow up with an allergist for a skin test. Be very cautious with your food.
I definitely will. Thank you for saving my life today.
Blue to the sky, orange to the thigh. That is such a catchy rhyme.
It is designed to be remembered even in a state of panic. Many people forget to remove the safety cap or inject the wrong end. This prevents that.
And follow up with an allergist. Finding out exactly what you are allergic to is the best defense.
Absolutely. Prevention is key.
We covered a lot of ground today, from identifying hives to using an EpiPen.
Indeed, in medical emergencies, your ability to communicate clearly can save your life.
Now it's time to practice. We have selected 5 essential sentences. Please listen and repeat after me. My throat feels tight. I am breaking out in hives. I feel like I am breathing through a straw. My head is spinning. Blue to the sky, orange to the thigh.
Great job. Repetition is the key to memory. Let's do it one more time. My throat feels tight. I am breaking out in hives. I feel like I am breathing through a straw. My head is spinning. Blue to the sky, orange to the thigh.
Perfect. Use these phrases to stay safe and clear in an emergency.
Communication could save your life. Practice these until they become natural.
Thanks for joining us today. See you next time.
Goodbye, everyone. Stay healthy.